Multiple myeloma is a hematological cancer of the plasma cells associated with significant morbidity and mortality. According to Fleming in 2025, it costs NHS England £209.2 million annually. Alongside the risk of death with a median lifespan of 10 years after diagnosis, myeloma can cause anemia, hypercalcemia, renal dysfunction and osteolytic lesions known as the crab features. The prevalence of myeloma is increasing. However, unfortunately, myeloma has the longest diagnostic delay of all cancers. Many patients are diagnosed with myeloma through emergency admission with a higher burden of end organ damage and reduced lifespan. Subsequently, this increases the economic impact due to the costs associated with advanced disease. Earlier diagnosis significantly improves outcomes and reduces the economic burden. Therefore, earlier identification within primary care is paramount. Monoclonal gammopathy of undetermined significance, a condition known as MGUS, where an abnormal protein is released from the abnormal plasma cells within the bone marrow, has been found to precede almost all diagnoses of myeloma. The risk of progression from MGUS to myeloma or other lymphoplasmacytic malignancies is low at approximately 1% per year, but continues with a lifetime risk. The British Society for Haematology recommends specific monitoring in primary care for patients with MGUS. This is to facilitate earlier diagnosis of myeloma or other lymphoplasmacytic malignancies and enable timely treatment. Avoidable myeloma diagnostic delays are linked to inconsistent testing and follow-up of MGUS within primary care, according to Ramsay in 2025. And in practice, delays in diagnosis of myeloma have been seen, some presenting with acute spinal fracture. Subsequently, a service evaluation led by a trainee advanced practitioner has been conducted to identify if the local MGUS population managed by this rural general practice in northwest England is in line with the recommendations from the British Society of Haematology. 5 benchmarks were identified from this British Society of Haematology guidance, which were used for this service evaluation and can be seen on the poster. Benchmark 1. Just over half of patients' laboratory testing was compliant with British Society of Haematology recommendations at diagnosis and subsequent follow-up. Urine for Bence-Jones protein was commonly missed at diagnosis. At follow-up, the specific tests for MGUS, serum protein electrophoresis, serum free light chain and serum immunofixation were missed more often. Some of these patients were on recall for other long-term conditions. Calcium was another commonly missed test at both diagnosis and follow-up. These results reflect the variance in confidence levels seen within the staff survey in identifying MGUS and the ongoing management, and highlights areas for further education. Benchmark 2. There was no documented risk stratification or recommendations for follow-up within the MGUS population. These results suggest benefit in clinician education on risk stratification completion and likely reflect the low levels of familiarity with the Myeloma UK and British Society of Haematology guidance seen within the staff survey. For benchmark 3, compliance with 6 monthly testing within the first year was just less than half, ranging from 1 to 7 months with a mode of 3 months. Therefore, some patients were over-tested and some less frequently than recommended. 4 patients had no further testing assessing for MGUS after diagnosis. However, the confusion in guidance with Myeloma UK also recommended 2 to 3 months follow-up may contribute to these findings. The ongoing monitoring after the first year was also not in line with the British Society of Haematology recommendations, with those not compliant primarily having no further testing after the first year. The majority of these were men, and this was the only significant gender difference, however is potentially coincidental. The 2 patients with more frequent monitoring were low risk MGUS and therefore was deemed not necessary. The lack of ongoing testing does align with other studies, including internationally, and also likely reflects the variance in confidence levels seen within the staff survey in identifying MGUS and the ongoing management. And modifying the process, therefore, could improve the service provided. Benchmark 4. The proportion of bone pain discussions at or after follow-up was low. The low levels of completion may reflect the lack of familiarity with the guidance and variance in confidence in the management of MGUS seen within the staff survey. Benchmark 5. Overall, there was good engagement with haematology where concerns were held about a patient. There was a tendency to over-escalate where it did not meet the British Society of Haematology criteria. However, this provides greater patient safety than if concerns were not escalated. This also likely reflects the variance in self-reported confidence levels regarding escalation seen within the staff survey. There were 4 patients that were not appropriately escalated. However, 2 of these had creatinine clearance within the threshold for myeloma defining events. Given creatinine clearance is not specifically recommended by the British Society of Haematology, the low levels of creatinine clearance completion may actually reflect the contradictory nature of the guidance and contributed to the reason these were not escalated. However, it does highlight an area for further education. The results from the staff survey reflect the lack of familiarity with MGUS amongst general practitioners seen within the data internationally. That's from McShane et al. In 2017 and 2019. There are no reported studies addressing the knowledge of other healthcare professionals that work within primary care. From the staff survey, one respondent self-reported to be very familiar with the Myeloma UK guidance, the ongoing management of MGUS, and when to escalate to haematology. And this may reflect working with these patients as familiarity has shown to help maintain understanding and awareness. From the staff survey, theme suggestions including education and guidance, alongside protocolising the laboratory testing and clinical discussions. Like these findings, clear guidance and education resources were found necessary to increase the knowledge base in general practice and improve the ongoing management of MGUS by McShane et al. In 2019. And these recommendations from staff in turn may help improve the challenge identified regarding consistency of management between clinicians and conducting follow-up, including bone pain discussions on time. 3 recommendations were made following this service evaluation. Recommendation 1, implementation of a patient diary and MGUS patient discussion. Myeloma UK produced a patient diary explaining MGUS, its monitoring and documented test results. Given patients' limited understanding of MGUS, which is seen in multiple studies, increasing patient knowledge may improve their experiences. It is felt that diagnostic delays may be reduced by facilitating targeted campaigns on the symptoms of myeloma by Cisagar et al. In 2021. And also the safety netting requires the provision of worsening advice. Therefore, it is recommended that this patient diary is implemented and discussed with patients at diagnosis and follow-up, and this may reduce diagnostic delays and improve patient ownership of follow-up. Recommendation 2 is implementation of a pro forma for laboratory testing and annual reviews. This service evaluation showed variance regarding MGUS laboratory testing. It is therefore recommended a pro forma is introduced listing the laboratory tests and intervals per chronic illness, which can be used when conducting annual reviews. This single patient-centred annual review should improve efficiency and enhance the patient experience over segregated reviews. Alongside this, given limited bone pain discussions, a template to act as a prompt and improve patient-centredness should also be implemented. Recommendation 3 is an education package on MGUS. It is recognised from this service evaluation and other studies that MGUS knowledge is limited within general practice. The study by McShane et al. In 2019. Earlier diagnoses of myeloma are attributed to education packages according to Cisagar et al. In 2021 and Smith et al. In 2022, and staff within this practice also recognise that benefit. And education packages have been shown to improve the knowledge of others. Therefore, the implementation of an education package to clinicians within the practice regarding MGUS, testing, risk stratification, progression and escalation is recommended. This would be available online and delivered within inductions, ensuring accessibility and sustainability of change.